5 things I wish all my patients knew before their induction from a high-risk labor and delivery nurse. Number 1, inductions can take a long time. I'm talking up to 3 days in some cases. There's a lot of factors that contribute to how long an induction may or may not last. For example, whether or not you've given birth vaginally before, or whether or not the cervix was already preparing itself for labor, whether it was ripening or dilating at all before we started the induction process. For the facility's policies and practices surrounding inductions, how do they do inductions? It's important my patients understand if it is taking longer than they initially expected, it doesn't necessarily mean this isn't going to happen. On top of all this, when they realize it may take longer than they expected, this may change their plans for childcare or who's watching their pet and things like that. Number 2, many facilities may not offer you any solid food throughout the entire course of your induction, but rather offer you clear liquid. Clear liquids is usually water, juice, gelatin, popsicles, some broth. The reason why this is a common practice to this day is another video in and of itself. I educate my patients on why this is a recommendation. At the end of the day, as long as the patient fully understands risk, benefits, alternatives, it's really up to them whether or not they abide by these recommendations. And what that means as the nurse is I allow my patients to exercise their right to say yes and no. As the nurse, I'm not allowed to technically bring them anything that is outside of that diet order. They are consuming solid foods, and this became a situation of a non-urgent C-section, may delay when we start the C-section based on when they last ate solid foods. Number 3, a lot of benefits to familiarizing yourself to the different methods of induction. I'm talking actual research from actual credible sources, asking any and all questions with your provider before starting the induction. Having familiarity and having your questions answered ahead of time can help you be more confident in the decisions you make. This really lays the groundwork for informed consent and advocating for yourself. Number 4, you have the right to say no. You can say no to medical students or nursing students. You can decline certain procedures, but the key to saying yes and no to things is having a full understanding to the risks, the benefits, and the alternatives to what you're saying yes or no to. And number 5, while the goal of an induction is a vaginal birth, C-sections are always a possibility. Some common instances is if you or the baby are not medically stable or safely tolerating the induction, a more urgent delivery is recommended for the safety of you or your baby. Maybe you've gone through all the different methods of induction that were safe and appropriate for you, but the dilating is just not happening. For information on pregnancy, birth, postpartum babies, give me a follow, check out my page.